Can medication help anhedonia and depression in schizophrenia? Can medication help with anhedonia and depression in schizophrenia? This is a question many people may have when considering treatment options. Anhedonia, which is the reduced ability to feel pleasure, is a common symptom in schizophrenia. It often overlaps with depression, making life even more challenging for those affected. Both of these symptoms can significantly impact daily living and recovery. Anhedonia is categorized as a negative symptom of schizophrenia. This means it reflects a loss of normal functioning, such as joy or motivation. Depression, while it can overlap with negative symptoms, is a separate condition that frequently coexists with schizophrenia. Addressing these symptoms is essential since they can hinder social interactions and the ability to engage in treatment. When it comes to medication, traditional treatments for schizophrenia primarily focus on antipsychotic medications. These medications mainly target positive symptoms, such as hallucinations and delusions. Unfortunately, negative symptoms like anhedonia are often less responsive to these drugs. However, some newer antipsychotics, like olanzapine, have shown promise in reducing negative symptoms, including anhedonia, particularly in people experiencing their first episode of schizophrenia. If depression is also present, doctors may consider adding antidepressants to the treatment plan. Selective serotonin reuptake inhibitors are commonly used for depression, but their effectiveness for anhedonia is limited. In some cases, these medications can even worsen emotional blunting, which may feel similar to anhedonia. There is some evidence that certain antidepressants like bupropion might help with reward-related symptoms, but results can vary. Other medications that influence dopamine levels, such as pramipexole or modafinil, have been studied for anhedonia in depression. However, there is little direct evidence for their use in schizophrenia. Ketamine has shown the ability to rapidly reduce depressive symptoms in some individuals, but its effects on anhedonia in schizophrenia are not well studied. For someone with schizophrenia experiencing both anhedonia and depression, treatment typically begins with optimizing antipsychotic medication. If negative symptoms persist, switching to a medication like olanzapine may be considered. If depressive symptoms remain as prominent and do not improve with antipsychotics alone, adding an antidepressant could be an option. However, the benefits of this approach are uncertain and should be monitored closely. It is important to remember that medication effects can vary widely from person to person. Regular follow-ups with a healthcare provider are essential to assess whether symptoms are improving and to adjust treatment as necessary. Non-medication approaches, such as therapy focused on building positive experiences and social skills, can also be beneficial and are often used alongside medication. Current evidence suggests that medication can help some individuals with schizophrenia who experience anhedonia and depression. However, the benefits are often partial and inconsistent. Antipsychotics like olanzapine may improve anhedonia in some cases, while antidepressants may not effectively address the core issue of anhedonia. Treatment should be tailored to each individual, with careful monitoring for both benefits and side effects. Combining medication with psychosocial interventions may offer the best chance for improvement in daily functioning and overall quality of life.